Garrath Williams from Lancaster University, Department of Philosophy. It's about the challenge that obesity poses to us ethically. Fairness, equal rights. Welcome.
Thank you very much. It's a great pleasure to be with you. I was asked to sound a few notes of caution about calls for evidence in public policy, and I'm happy to do so because I want to argue that when we're dealing with complex problems, which we always are in the policy domain, evidence is never going to be straightforward. Let me say right at the start, I don't want to mean that in any way as an argument for ignoring the evidence that some of the previous speakers have highlighted. We have a real political problem there. But I do want to say that in the policy domain, it's always a case of integrating diverse sources of evidence to understand a problem, and that we'll never get straightforward evidence in advance or even retrospectively as to whether a policy works. So there's a simple definition of evidence: facts or information that provide us with grounds to believe a proposition or a theory or an explanation for a problem. Even for quite a simple fact, say for instance whether somebody committed a murder or not, we know that gathering evidence and assessing it can be a very complex matter. Well, a complex social problem, our gathering of evidence, our weaving it together is definitely going to be a very complex exercise. I think that's really very clear, but it sometimes gets lost from sight when we talk in rather simple ways, for instance, about gold standards for evidence. And I'll come to the example of randomized control trials in just a second. Or when we talk about evidence as telling us what works, as if that were going to be a simple matter. And I want to suggest that even in the case of the relatively simple case of a biological intervention with a single human being, evidence always turns out to be much more complex than a single gold standard or what works. So, relatively simple example. This is where the talk about evidence has come into the policy domain from, the medical context. Does a particular drug help these particular sorts of patients? Well, we know that randomized control trials are a very good way to provide us with evidence for that in either direction, whether it works or not. Can show us that it works, but this isn't really the gold standard that it's sometimes carelessly purported to be. It's more like a black box. We know what went into the patient, we know whether or not they got better. It doesn't tell us anything about what happens in between. It doesn't give us any evidence for the causal pathways. For that, we need quite different sorts of evidence. And that really matters because if we want to know whether the drug is likely to work for other sorts of patients, for instance, the more typical sorts of patients that you see in the clinic who may be elderly or infirm or have other diseases and be taking other medications, you need to know much more about the causal pathways to assess whether it's going to be sensible to use that drug with them. So, if you want to know even about this relatively simple case, you need to integrate diverse sources of evidence, and that's quite a complicated exercise. It's not just whether it works, it's how it works, and then whether it's likely to have side effects or other effects when you take it to a different condition or person. Now, come to a complex problem. Here's the iconic representation of the complexity of obesity. I've deliberately chosen something that's completely indecipherable to all of you. You can't read, I think, anything on there, partly because the beamer is rather blurred, but even so, if it weren't, you still couldn't, because it's an extremely complex causal network with many actors and factors involved. And that tells you straight away that many, many different sorts of evidence are going to be needed to be assembled, to bring and brought together to understand this complex problem. It also tells you that for different individuals, that was a representation for a sort of average composite adult in modern industrial, liberal, commercial society, for different individuals or for different social contexts, the causal networks are likely to be rather different. And that matters because something that works for one individual or one community or one society may well not work where the causal fabric, the causal network, has a slightly different shape. Efficacy in one place is no guarantee of efficacy elsewhere with a complex intervention for a complex problem. It also tells you, with all these different causal connections, that something that's effective on one dimension is very likely to have effects with regard to other goals or priorities. It's likely, as in the pharmaceutical case, to have side effects. And one other thing that diagram shows you is that there are many, many different points for intervention. And thinking about those, of course, is not going to be simply a matter of evidence. Intervening is about changing things. You can't get evidence in advance for making a change to a complex system, because every change that you make is going to be different depending on how that actual system is. So you can get suggestive evidence, but it's going to be a case of using imagination and experimentation to think about possible interventions. So having sounded some notes of caution about evidence in the policy domain and evidence for obesity interventions, let me suggest some more optimistic points, because I don't want to argue at all that we shouldn't be intervening at the policy level. I want to suggest that we have good reasons to intervene, despite the fact that we'll never have concrete certain evidence as to what works or what might cause side effects on other dimensions. So the first thing to note is this is a complex system made up of intelligent people and, hopefully, competent organizations. And intervening in such a system is much safer than giving someone a pharmaceutical product. You can implement a policy intelligently. You can get feedback, so long as there's sharing of knowledge and relative openness within a society. You can get feedback on how the policy is working and revise it, or perhaps abandon it, or alter it, as the case may be. So we have the possibility for intelligent adjustment of policies. What we also have, and this is again rather different from the pharmaceutical case, where any drug is almost certain to have adverse effects on other biological systems within the body, what we also have is the possibility of interventions having helpful effects on many different dimensions. I'll come to some examples in a moment, but just think, for example, that many of the things that we would want to do to challenge childhood obesity would also involve increasing or tackling problems of unsustainability within our food systems. So we can try to address multiple goals. In fact, policymakers always have to address multiple goals. And that means that the question you need to ask about a policy is not whether it works on a single dimension. You need to evaluate it across the many different domains and goals that it's likely to affect. I've emphasized that social systems and policy interventions have dismaying complexity, but just like the human body, they also have persistent structures that can provide targets for intervention. That's why we can draw a diagram of them and represent them. They have a structure. And some of those structural features can be extremely simple and provide ready targets for intervention. I'll give you two examples, one of which has been already discussed repeatedly during this conference. Price mechanisms are designed to be extremely simple. They work very well in food markets. Food companies use them relentlessly in their promotion of products, and they can be used as a political tool. It's actually not that difficult to design a tax that will reduce consumption of sugary drinks. Quote on the right-hand side there from the UK's awful Food and Drink Federation, abusing the language of complexity to suggest that a complex problem can't be solved with a simple intervention. Well, it can't be solved, but it can be helpfully tackled. And let me just emphasize my point about a policy serving several goals at once. Even if it were the case that a tax on sugary drinks didn't reduce consumption, it could still be very successful, in fact it would certainly be very successful, in raising funds that could be used for public health initiatives. Or a second example. This is from Diane Finegood and colleagues trying to make sense of that very complex diagram from the Foresight report. So they simplify and map the main causal connections. And as you can see there, under contemporary industrial food production systems, consumer choices have no direct effects on the food that is grown and produced. That means that consumers, as consumers, have absolutely no power to change our food production systems in a healthier direction. Or in slightly different terms, it's not going to be consumers who deal with the, not just the unsustainability, but the general unhealthiness of our food production system. It's going to be citizens and concerned organizations. And it tells you that we can't just intervene at the consumer level, we need to be directly concerned with how our agricultural and food production systems work and act onto those. And then, just to return to my broader point, those 2 points of intervention, appreciating those isn't so much a matter of evidence, it's a matter of a broader picture that integrates and synthesizes that evidence and enables you to understand the social context in which you intervene. So, just quickly to summarize, I've suggested that evidence for any complex issue is always going to be a complex matter. We need understanding more than we need, as much as we need evidence. Evidence about what works is no good without knowing how it works. Intervening in complex systems, well, you're never going to be sure in advance whether something will work directly. But there are ways to make out simple targets for intervention without any guarantees in advance that they'll necessarily work. And if you want guarantees in advance, well, maybe abandon the policy domain altogether, which we can't afford to do. Thank you very much.